Hi friends, this simple introduction aims to provide a clear and relatable overview of aphasia. The visuals help to convey the main concepts in an accessible way. Whenever we examine a patient of aphasia, the first thing we have to examine is word output. Word output in any patient of aphasia can have two of the patterns. The first pattern is decrease of the word outputs. Then we will classify it as non-fluent aphasia. If the word output increases, then we will classify it as fluent aphasia. After examination for the word output, we will classify the patient in either non-fluent or fluent category. In the non-fluent category, we have to see the comprehension. If the comprehension is good, then the next we have to examine repetition of the speech. If the repetition is also good, then we will classify it as transcortical motor aphasia, which means that patient is having decreased word output, his comprehension is good, his repetition is also good. If the patient is having poor repetition, then we have to examine for the writing skill of the patient. If his writing skill are also poor, then we will call it as Broca's aphasia, which means that his word output is reduced, his comprehension is good, his repetition is poor, and writing is also poor. If the patient is having intact writing skill, then we will label it as verbal apraxia, which means that patient is having decreased word output, his comprehension is good, his repetition is poor, but his writing is intact. In the next step, we have to see the poor pattern of the comprehension. If the patient is having poor pattern of comprehension in the non-fluent category, then we will have to examine the repetition. If repetition is good, then we label it as mixed transcortical aphasia, which means that patient is having reduced word output, his comprehension is poor, but his repetition is good. If the repetition is poor, then we label it as global aphasia, which means that his word output is reduced, that is non-fluent, his comprehension is poor, and his repetition is also poor. Next comes the fluent part of the aphasia. That means the patient is having increased word output. In such patient, the first thing we will see is comprehension. If the comprehension is good, then we will examine for the repetition. If the repetition is also good, then we will label it as anomic aphasia, which means that patient is having increased word output, his comprehension is good, and his repetition is also good. If repetition is poor, then we will label it as conduction aphasia, which means that patient is having increased word output, his comprehension is good, but his repetition is poor. In the next part, if the comprehension of the patient is poor in a case of increased word output, then we will examine about repetition. If repetition is good, then we will label it as transcortical sensory aphasia, which means that patient is having increased word output, his comprehension is poor, but his repetition is good. If the repetition is part is also poor, then we will see the reading skills of the patient. If the reading skills are poor, then we will label it as Wernicke's aphasia, which means that patient is having increased word output, his comprehension is poor, his repetition is poor, and his reading skills are also poor. If the reading skills are intact, then we will label it as pure word deafness, which means that the patient is having increased word output, his comprehension is poor, his repetition is poor, and his reading is intact. Now we will summarize all the above previous discussions. So, whenever we find a patient of aphasia, we have to examine the language function under the first heading of word output. If the word output is decreased, then we classify it as non-fluent. If the word output is increased, then we classify it as fluent. Now, in a retrospective manner, we will see first the diagnosis and what are the findings which comes under that aphasia diagnosis. For example, the first is cortical motor aphasia, in which the patient is having decreased word output, his comprehension is good, his repetition is also good. Then comes Broca's aphasia, in which the word output is decreased, the patient is having good comprehension, but the repetition is poor and writing is also poor. If the patient is having decreased word output, her comprehension is good, writing is intact, and the repetition is poor, then it comes verbal apraxia. Then comes mixed transcortical aphasia, in which the patient is having decreased word output, his comprehension is poor, but his repetition is good. If the patient falls under the category of global aphasia, his word output is decreased, his comprehension is poor, and his repetition is also poor. Now we will move on to the fluent aphasia. In fluent part, we have to first discuss about anomic aphasia. In anomic aphasia, the patient is having fluent speech, his comprehension is good, and his repetition is also good. Whereas in conduction aphasia, his speech is fluent, the comprehension is good, but the repetition is poor. If the comprehension is poor, then we have to see the transcortical sensory aphasia, in which the patient is having fluent speech, his comprehension is poor, but his repetition is good. In Wernicke's aphasia, the patient is having fluent speech, his comprehension is poor, his repetition is poor, and his reading is also poor. Whereas in pure word deafness, he is having fluent speech, comprehension is poor, repetition is poor, but his reading is intact.